Hey everyone, thanks for joining us again this week. Today is episode 11 and we're going to be talking about bed mobility and transfers. My name is Christie Amundson and I am a physical therapist and I'm also 30 weeks pregnant this week. And we are still uploading weekly topics that are relevant to pregnant and postpartum women. And we've already talked some in the previous weeks about the fact that during pregnancy, our joints become less stable due to a few hormones, but mostly the main hormone that's responsible for it is called relaxin. And its main job is to act upon the joints in the pelvis to make them a little bit looser so that a baby can more easily pass through the pelvis in the birth canal. So that is a good thing, we want that. However, what we don't necessarily desire but are kind of stuck with also is before and after that, all of the instability that lies with our body because of that. So that hormone is not, although it's mainly supposed to be acting on our pelvis ligaments, it is not specific to that. So it really acts upon our whole body, makes our whole body a little bit less stable, more loose. And a lot of that instability and pain we feel with transitional type movements. So getting up and down from a chair, from the floor, in and out of the car, rolling over in bed at night, or getting in and out of the bed. And what I wanted to talk about today are some tips and ideas of how to do some of those things a little bit easier and a little bit more safely and comfortable for you. So we're going to go into that right now. Okay, so here is my simulated bed. And I would say, generally speaking, I'm going to start out with rolling over in bed and getting in and out of bed. I would say for me personally, those two are probably the top of my list in terms of instability and feeling a lot of pain and difficulty with. A lot of that has to do with if you're in one position for a prolonged period of time. So sleeping is the best example of that. When you're up and moving around throughout the day, you have lots of blood flow going to your tissues, especially your muscles, which are helping to stabilize those unstable joints. So at night, when you don't have as much blood flow because your muscles aren't really demanding a whole lot when you're sleeping, your joints then when you wake up, because your muscles haven't had that blood flow, aren't as ready for all that movement, they don't stabilize your joints quite as quickly or as well. So then we end up getting more instability, more movement in those joints and more pain. At night, same thing kind of goes with if you've been sitting for a long period of time or in any position, driving for a long period of time, and then you go to get up or get out of the car, same kind of thing will happen. So when you're laying in bed, if you're looking for some good sleeping positions, check out episode 2. I go over a lot of different sleeping positions, mostly on the side. So usually you want something between your knees. Sometimes you'll have a fancy maternity pillow. Sometimes you'll just have some pillows stacked between your knees. But when you're on your side and you want to roll to the opposite side, what I would recommend, a lot of times what people will do is they'll move one leg first and then bring the other leg over. I don't recommend that. It's going to split apart where your pubic symphysis is and kind of shear and cause more pain there. So you can do one of two things. You can either keep this pillow in here and roll, so you're going to push with your bottom arm here, or your top arm I should say, and keep the pillow in, and kind of you shouldn't squeeze it hard, but just hold on to it, and then you will move slowly to the other side. Now this is a small bed, but you may have more room and may not need to scooch like I am. And then going to the other side. Or if holding on to something doesn't feel good in your pubic area, you could take the pillow out. So if I'm back over here, I could take the pillow out and hold on to it and then move. And basically I'm going to just keep my knees a couple inches apart. Again, I don't want to splay them all the way apart, but I'm going to keep them a couple inches apart and move like this. I would say for me personally, my body doesn't really like hanging on to anything. It makes my pubic pain worse. So I like it better to take the pillow out until I'm in position, and then I put the pillow back in. The other thing, if that doesn't fully alleviate your symptoms, there's a couple other things that you can try. Like I said, sometimes, for me personally, sometimes one thing works one time and another thing works another time, and I can't really explain it other than the fact that your pelvis is just very, very unstable during pregnancy. But what you're going to do is, with or without the pillow, when you start to roll, and I always have a lot more trouble when I go and I start to lower myself down to the other side. So if that's the problem, what you can do is push your feet into the tape, or into the bed, excuse me, and act like you're trying to kind of pull back toward your butt. You're not actually going to slide your feet back, you're just going to try, and by doing that, it engages the backs of your thighs, your hamstring, which will help stabilize your pelvis some. So when you do this, you would push down, tug back a little bit as you lower down, and that will give you some extra stability with your pelvis as you're lowering to the side. The other option you can have, or you can do both, that sometimes works for me, is I will take one arm to kind of assist me to roll, and I'll take the other arm and push my hand down into my thigh a little bit, and that will engage my kind of oblique abdominal muscle. Again, your ab muscles are kind of really overstretched in pregnancy, so you don't want a maximal contraction of those, but by doing one side like that, you're getting more kind of that oblique ab, and it also is a pelvic stabilizer, so it can really help. So again, depending on what works for you, like I said, sometimes I have to try all of these things, and sometimes one works better than the other. I know for me, no one thing works every single time, so I have to just kind of rotate around, but see what works for you. If something does work for you every time, go for it. Then, where'd my pillow go? When we talk about getting up and down from the bed, generally speaking, getting up is usually harder or more difficult than laying down, but you want to make sure that you're on the edge of the bed on your side, and then you want to kind of scoot your body. So I'm going to take the pillow out. I'm going to scoot my body so that my legs, when I kick them, they hang off the bed like this. And I can use the weight of my feet and lower legs to help me get up. And then I'm going to use my arm to push as I drop my feet off, so that I kind of come up as a unit. Going down, would you just reverse that? So when you go down, you're going to lean over on your arms and bring your legs up at the same time, like that. Now, if that still bothers you, which I would say it does me as well, I will often push with one hand to get up and use my other hand on my thigh like I was just showing you before. So I will push my hand here into my thigh, and so that it engages my ab as I do that same sit-up. And that actually really helps me to sit up pretty pain-free. So try some things. The other thing you can do is I would experiment with the side of the bed that you sleep on. So if you find that no matter what you do when you get up, it really is painful on this one side, try, if you have like a queen size bed or a king size bed, try switching. If you sleep with somebody else, try switching sides, or even just trying to switch sides and seeing if going down on the other side bothers you just as much, because sometimes it doesn't. Again, I would not change everything in your whole room around for just after trying it once, because sometimes it changes. However, if it's pretty consistent that it feels better to do it one direction, then I would just maybe switch sides of the bed that you're sleeping on, at least for the remainder of your pregnancy and kind of postpartum period. Okay, so now we're going to talk about some transfers up and down from a chair, the floor, and the car. So let's go. All right, so when we're talking about getting up and down from a chair, the main thing that you're going to want to think about is trying to push through your heels when you're getting out of a chair. And if your chair happens to have arms, you can use your arms some, but a lot of the mistake that a lot of people make is using their arms a little too much, and it gets to the point where they put pressure on their back. So what I mean by that is if I use my arms too much, I get to a certain point where I have to bend backwards and then push up, and you can see how that's really kind of arching and stressing my back when I do that. So I can use my arms in the very beginning to help kind of initiate the movement, but then you'll want to keep your weight forward, push through your heels to stand up. And certainly you can use it still for balance on one side, but I wouldn't recommend trying to use it for both sides on balance, because again, that would arch your back too much. So, and then when you're sitting back down, making sure that you check for safety as far as how far away you are from the chair, and then lowering yourself into the chair through your heels, and then using your arms just to check, make sure, especially if the chair has wheels on it, that it doesn't run away from you. If you're looking for sitting position recommendations, check out episode 3 for low back pain that we talked a lot about kind of sitting and standing general positional recommendations. When you're doing transfers though, trying to push through your heels and using your arms only for like the initiation when you're standing up, and then right before your butt touches where your hands actually touch. Again, if I reach back too much as I'm sitting back down, that makes me arch my back, which we don't want. Okay, and then I'm going to simulate a car here. So if I am driving in a car and the door is on my left, and if I'm going to get out of the car, most of the time we are used to kind of opening the door, taking one step out, and kind of just transitioning out like this. Okay, that puts a lot of pressure, uneven pressure on our pelvis or stress. So I don't recommend that. What I would recommend instead is swiveling your entire body out. So kind of like what we talked about with lying down, you're going to keep your legs the same distance apart, a couple inches, and you're going to turn your whole body in the car to face outside, and then stand up similar to what we just showed you with the chair. So using your arms if you need to at first, but pushing with your heels, standing up. And then when getting into the car, you would reverse that. You'd open the door, turn your body all the way around, lower yourself in the seat, and then scoot back first, and then kind of swivel, trying to keep your legs relatively together. So not swiveling one leg followed by the other leg. So you want to keep them together. If you find, kind of like on this mat, it's kind of sticky. If your clothes and or your car seat is such that you're sticking on the seat and you can't really swivel that well, a lot of times if you sit on a garbage bag, to be honest with you, it'll help you swivel a lot easier. So that's just a little trick we use sometimes. So I want to also show you getting up and down from the floor. So we'll do that next. Okay, so if you need to get up and down from the floor, what you're going to want to do is use a transitional surface such as a couch, or the firmer the better, the seat of a chair, any of that, the arm of a couch will work. That is either if it's up here or a little bit lower, you're going to put your hands or your elbows on it, whichever one feels more comfortable to you. But instead of going down where you're lowering with one leg like this, like we would normally do, again, that puts a lot of uneven kind of stress or pressure on your pubic symphysis and SI joints in your back. So instead of that, we're going to put your hands down, keeping your feet kind of equally weight equally distributed, and feet apart, about hip width. You're gonna put your hands on the table or elbows down, and then you're gonna walk your feet back a little bit. And that now I have about half of the weight on my arms and half of the weight on my feet. And then I'm going to lower myself to the ground where my knees are going down. Like that. So now my arms do have to work a little bit, and so do my legs, instead of putting all the pressure on your legs. Then you would reverse it to stand back up. Again, elbows or hands. I find it, if the surface is like a seat of a chair, which is the height of this table, I find it a little bit easier when you're coming up to go down on your elbows. And then you're going to push your butt up in the air. So you're going to go like this. And then you're going to slowly walk your feet, small steps, toward your arms to stand up. So that's the best way, getting up and down from the floor, to put the least amount of kind of that uneven pressure on your pelvis. So hopefully some of this stuff was helpful for you. If it was, please give us a thumbs up and subscribe. Hit the bell icon to get more notifications of our uploads that we're doing weekly. And I hope to see you next week. Take care.